Nutrition in the ICU is very important for the patient's well-being. Often it's something that can easily be overlooked, but really it's something that we should be thinking about for every patient in the ICU. Now, patients who are critically ill have different challenges for providing nutrition, mostly because a lot of our patients can be sedated and on a ventilator, and so we have to get creative with how we give them nutrition. There are two major ways that we can give people nutrition. One is through their gut, which we call enteral feeds. The other is intravenously, which we call parenteral nutrition or total parenteral nutrition, or TPN for short. When you have patients who have a breathing tube, obviously they're not going to be the patients who are chewing and swallowing their food safely on their own. But patients who have breathing tubes typically will have what we call an oral gastric tube, where they have a piece of plastic tubing that goes from their mouth into their stomach. The advantage of this is that we can decompress their stomach or put that tube on suction and empty out anything that's in their stomach, but we can also use it to feed them as well. Patients who are extubated, we try and move this gastric tube into their nose, and there's two different types of tubes that we can use in the nose. One is a nasogastric tube, which is similar to the oral gastric tube, where it's a more rigid plastic that's a little bit bigger in caliber that allows us to either suction or feed through that tube. The opposite of that, or the other option of that, is called a Dopphoff, which is a skinnier, narrow tube in caliber size, which we can use for feeding and for medications. But because it's not as big as a nasogastric tube, we can suction off of it. There's two major reasons why nutrition is so important in the ICU. The first being is that nutrition provides immunologic function or immunity function. So it helps patients fight off infections or prevent infections, as well as promotes wound healing. The second biggest reason we want to provide patients with nutrition is so that they have some sort of carbohydrate source to provide ATP to their cells. ATP are sort of the powerhouses or the energy molecules that keep our body functioning. And when our bodies don't have carbohydrates in them, they look for other sources to create ATP, and that usually comes from the muscles or fat. This is usually in the realm of glycogenolysis or in lipolysis. So by giving carbohydrates, they're able to create ATP, and you prevent any muscle or fat breakdown, which would then make it that much harder for patients to recover and recuperate after staying in the ICU. If a patient for some reason has any contraindication for having a tube go from their mouth or their nose into their stomach, or if we think that this patient is not going to gain any functionality in their swallowing even after they have the breathing tube removed, and they're going to need nutrition for a long period of time from an alternative way, then we'll do what's called a gastrotomy tube, where they have a tube coming from their skin into their stomach that we can provide nutrients to. Now, once we start feeding patients, we typically start at a low rate of what we call trickle feeds. This is somewhere in the realm of 10 mLs or 10 cc's per hour of feeding. And then that slowly gets ramped up over the course of a couple hours until they eventually get to what we set their goal at. Now, if you're using a 1 kilocal per ml feeding solution or a tube feed solution, usually their goal rate that they'll need is a 1 ml per kilo per hour goal. So let's say you have an 80 kilo patient, eventually their goal for tube feeds will be 80 mLs an hour. And that's because if you do the math for energy requirements, typically patients need about 24 kilocalories per kilogram per day. And if you break that down per hour, it's going to be 1 kilocal per kilo per day. And since you're talking about a 1 kilocal per ml basis, this math works out really well, so that whatever the patient's weight is, that's what their goal rate of tube feeds is going to be. So even though our patients are very critically ill and we're mostly used to talking about the brain, the heart, and the lungs, ICU nutrition is something that shouldn't get overlooked and something that we take very seriously, because it's going to help patients, one, get out of the ICU, and two, make a somewhat fuller recovery as they get out of the hospital and move towards getting back to their normal life.